Have you ever been overworked, stressed out while on the job, afraid you can't handle what's being expected of you? This is every day for a hospital nurse working under unsafe staffing conditions. Nurses need to have federally mandated safe staffing ratios. When you or a loved one needs to be treated at a hospital, you want the best care possible. This is becoming harder and harder while nurses are dealing with unsafe staffing and dealing with burnout. My name is Laura Martin, and this is my policy debate on why nurses should have safe staffing ratios. In this debate, I will be covering unsafe staffing assignments, who or what is to blame, solutions to the ongoing issues, and benefits versus the cost of mandated ratios. Now that I have reviewed the main points, I'll move on to review the ill or the problem. There's an ongoing problem with nurses being assigned unsafe workloads. The article Nurse-to-Patient Ratios State-by-State Guide, published by Gale Healthcare Solutions on January 14, 2021, mentions that the recommended nurse-to-patient ratios are as follows. The ICU is 1 to 2, the OR is 1 to 1, the ER is 1 to 3, Med-Surg is 1 to 4, and Rehab is 1 to 5. Now, while these do exist, they are just recommendations, and they're often not followed. According to Amy Blitchok's article, Proposed Federal RN Ratios, What You Can Do About It, posted on January 6, 2018, nurses are often put into difficult situations where they are coerced or pressured to care for too many patients at a time. In this year alone, there have been many strikes held by nurses in regards to unsafe staffing. The article, Healthcare Workers and Nurses Around the U.S. Call for Safe Staffing Ratios, posted on September 28, 2021, by Alfred Kurosawa, reports that in July there was a 2-day strike in L.A. In June, there was 3 called-off strikes in Connecticut, and in September, a 1-day walkout in Alabama. And those are only a few of the many strikes being held by nurses to raise awareness of this issue and demand safer staffing. Now that I have identified the problem at hand, I will discuss the cause of this issue. Hospital organizations and administrators, along with the current nursing shortage, is causing this problem. According to the article, Unsafe Nursing Ratios Incapacitate EDs and Endanger Patients, posted by Tommy Eels on April 8, 2019, hospital associations and executives are the major opposers to nurse-to-patient ratio laws because fixed ratios leave little flexibility in scheduling around patient volume. Sean Clark and Nancy Donaldson's article, Nurse Staffing and Patient Care Quality and Safety, published in April of 2008, reports that hospital administrators set the staffing levels. They could change them if they really wanted to, but they consider other factors such as budgets, and to simply put it, they think it's too expensive. There's already a shortage of qualified nurses, leading to these same administrators requiring mandatory overtime from their nurses. This tries to accommodate the patient load, but however, it's sometimes not enough, and nurses are assigned more patients than is safe. According to Alfred Kurosawa's article, Healthcare Workers and Nurses Around the U.S. Call for Safe Staffing Ratios, nurses have been forced to work through lunch hours and scheduled breaks while in unsafe staffing conditions to make up for the lack of staff. So after reviewing the cause or the blame, I'll now move on to discuss solutions. A federal law regulating nurse-to-patient ratios would solve this problem. The article, Healthcare Administrators Need to Improve Nurse-to-Patient Ratios, published by the University of Texas at Arlington on October 14, 2020, states that the nurse-to-patient ratios currently vary widely between different states, facilities, and areas of care. While there are few existing regulations for suggested ratios, there is no definitive parameters, leading to making appropriate staffing decisions without much guidance. According to the article Nurse-to-Patient Ratios State-by-State Guide, published by Gale Healthcare Solutions in January 14, 2021, There are only 12 states in the United States that have introduced statewide regulations and committees addressing nurse staffing in hospitals. Out of those, California and Massachusetts are the only two that have laws governing safe staffing policies. This leaves room for administrators in all the other states to set ratios as they see fit. A federal law would assure that all nurses in the country receive the safe patient ratios that they deserved. As previously mentioned, strikes and protests have occurred, while the hospital systems compensate to resolve this problem. But how long will this last? How many more hospitals and nurses need to suffer before federal legislators allow a law to pass? There needs to be a surplus of letters written to senators to advocate for the struggling nurses and help this change happen. So now that I have reviewed solutions, costs and benefits will be discussed next. So do the benefits outweigh the costs? Absolutely. Hospitals will not be able to accept as many patients to be treated at a single time. However, safer, more effective nursing care, improvement with staff satisfaction, and an increase in mental and physical well-being of staff are all benefits that outweigh these costs. Sean Clark and Nancy Donaldson's article, Nurse Staffing and Patient Care Quality and Safety, states that the quality of nursing care is not only influenced by the nurse's knowledge and experience, but also factors such as fatigue and their mental state. Fatigue and stress are major causes to compassion fatigue or burnout, which negatively affects the way nurses provide care. Gale Healthcare Solutions article, Nurse to Patient Ratios State-by-State Guide, lists many benefits to safe staffing ratios, including less medication errors, lower patient mortality, shorter hospital stays, lower readmission rates, increased patient satisfaction, higher patient care survey scores, and less nurse burnout. I have now reviewed the costs and benefits, so I can move on to the conclusion. Nurses need federally mandated safe staffing ratios. We have reviewed unsafe staffing assignments, hospital administrators and the nursing shortage being the cause, mandated nurse-to-patient ratios as a solution, and the costs versus the benefits. Next time you're in a hospital and you're getting anxious or angry about the wait time, don't get mad at the nurses. Instead, get mad at the system and advocate for those nurses to have more help. I hope that there is an end to this problem soon and that better conditions can be provided for our nurses and their patients.